this resolution diet isn't working so well, you may think maybe I should take a step further into liposuction or some other procedure. So
right.
Dr. Rhys Branman is here to tell us if that's how it works. Good to see you.
Good to see you,
yeah,
too.
welcome back in.
Thank
Said
you.
You've been on a little vacation.
I was on a little vacation.
Back at work. Good.
Yeah, I'm back to work, and we're busy.
Good. Well, we want to ask you some questions about liposuction because first of all, a lot of people think, well, I can always go do that to lose weight.
That's
Is it a weight loss treatment?
It really isn't. It's really good for when someone has certain little areas that they just want to get rid of, especially in the hip area, tummy area. Those seem to be really areas that people really want to have them removed, and they sort of gain in those areas but never really lose in those areas.
Okay, so if someone comes in and they really you can tell they really haven't tried seriously to lose weight on their own, you don't suggest lipo?
I really don't. If they can be at their sort of a stable weight, then I think that's a great time to do liposuction. But I think if you have a lot of weight on you, I think you need to lose some weight first. And then those areas that are residual, those areas that are just left over, liposuction is perfect for that.
Perfect for those places that you just don't ever seem to lose weight in those spots. We're going to take a look at a few of those with some pictures. Now there's liposuction, ultrasonic liposuction, and traditional. So what's the difference?
I think the ultrasonic is actually a little bit better. And the difference is that the traditional, we would just go in with a cannula and take out the fat.
Yeah.
And you've seen those pictures where they're kind of yeah, it looks terrible. It looks pretty aggressive. With the ultrasonic, what we do is we put a small little wand inside the fat, and it breaks up the fat. Gets rid of, it doesn't get rid of the fat, but what it does is it breaks it up so it's very easy to take the fat out. And so it's a lot less traumatic, you get a lot less swelling and less bruising, and I think you get a smoother result than traditional liposuction.
So that's called ultrasonic.
That's ultrasonic or vaser liposuction. We've talked about that. So vaser liposuction.
Cool. All right. Well, here's some pictures to kind of show you what can happen before and after.
And I think you can see that you've got some nice changes, especially in the hip area here. She had a little mini tuck with that, so we tightened her a little bit this way, but you can really see in the hip area that you get this nice smoothing and nice decrease in volume, which is what liposuction is all about.
And would there be a scar here?
You might have a little tiny scar down here, which is off your picture. But you can also see how the tummy is a little more defined. You get a little more definition of the abdominals, and I think, you know, this is the kind of thing that liposuction is really good for.
Yeah. How quickly do we get from this to this? Is there a little time?
About 6 to 8 weeks. About 6 to 8 weeks.
Is there some sort of swelling or something?
There is a little swelling. We have you wear an abdominal binder, which is something that will kind of cinch the abdomen. And this is a combination of liposuction and tummy tuck, so we get rid of the little stretch marks there, plus bring everything in. So it's a nice combination.
And you can actually make the belly button look better with the tummy tuck.
We can make the belly button look better, and that's nice for bathing suit season.
It's a lot cuter, isn't it?
It is a lot cuter.
Okay, let's talk about, you mentioned vaser liposuction, and that you can also combine the liposuction and a tummy tuck. Is that being done pretty often now?
Yeah, we're doing that, where we'll take some fat from the sides and sometimes from the upper abdomen, and then combine it with a tummy tuck to get really the maximum results that you can get.
Very good. When will they start feeling good again? You said 6 to 8 weeks.
Yeah, I would say within about 2 to 3 weeks they'll start feeling good.
And I would think you suggest they continue their good nutrition and their workouts.
Yes, we want people to be able to keep the weight that they're at. We don't want them seesawing where they go up in weight and then down in weight. That's just not a good way to kind of proceed after you've had a tummy tuck or liposuction. And
do you have a way that actually liposuction can be free? I've heard that on television.
Oh, if you're interested in a breast augmentation, we're offering one side of liposuction free with that, which is really actually kind of a fun little offer that we're doing for this month.
So if you've been considering the breast augmentation, it might be a time. And would you do that all at the same time?
That you can do all at the same time. So if you got a little something right here and you want a little breast augmentation, we can do it for you.
You would wake up a new woman.
You would wake up a new woman ready for bikini season.
Awesome. All right. Well, let's put up the information because you may have more questions about this now that Dr. Rhys has talked about it a little bit. Of course, this place is Cosmetic Surgery Center on Executive Center Drive, right there in West Little Rock, 227-0707. And of course, they were named Best of the Best.
Thank you very much. Yes, we were. And that's great.
For cosmetic surgery. So they are good at what they do. Go ahead and give them a call if you have more questions about this. And as swimsuit season gets closer, I know you're going to have a lot of people interested. But it needs to be the right candidate, right?
Yes, it does. And that's what the evaluation is all about.
Very good.
Come on in. We'll tell you how to.
He'll tell you if he can help or not. Thank you, Dr. Branman. Thank you so much. Good to see you as well. And